Good afternoon, everyone. Thanks for joining us on this media briefing for Wednesday. We're going to get started with our friend from Natividad, Dr. Gary Gray, the CEO. He's going to tell us a little bit more about the pop-up testing sites that they are operating. I think the second one is happening today. Hi, Dr. Gray.
Hi, good afternoon, everyone. So certainly happy to share kind of our pop-up testing that we've been doing. We started last week at Seaside, completed just over 100 tests, and we were doing a drive-through model, so all testing occurs, within the patient's private vehicles. Today we're in Marina, and as of approximately 11 o'clock, we had just over 100 people in line. So again, we're having a significant turnout for testing in Marina today as well. I think folks sometimes wonder, how do we decide where to go? I think Dr. Moreno shared some testing data at the briefing with the Board of Supervisors meeting yesterday. And as you can see, there were still several areas of the county in which the frequency of testing or the availability of testing was low. So we're really concentrating on those areas where the frequency of testing has been relatively low. So we hope to, be able to get data on those particular areas of our county, and all results will be shared with the health department and entered into their master reporting.
Great, thank you very much. And if you would just stay on the line, we'll take questions from the media after our next presenter. We have Dr. Moreno on the call today. Always happy to have him when he's available. He's here to give us an update on public health. Hi, Dr. Moreno.
Oh, hi, man. Good morning. Good afternoon. So updates I have, just that we have, as far as testing, we continue to do testing, and the private labs, the commercial labs, and the public health labs are doing the majority of the testing. But we're very grateful that the hospitals and now other clinics are beginning to increase availability of specimen collection from their primary care locations. So that's reassuring, and that includes the Monterey County clinics under the Clinic Services Bureau. So that's additional resource for specimen collection and here in Monterey County. As far as contact cases and contacts, we continue to have, compared to prior weeks, we continue to have a greater number of cases reported to us on a daily basis. And we have 1,075 confirmed cases, and we still, fortunately, are still at 12 deaths. And we have overall 92 individuals that have been hospitalized for COVID-19. The total number of contacts, close contacts to those confirmed cases, totals just over 4,000. But the in the last couple of weeks, the number of close contacts associated, on average, with each case has gone from about 4 per case to, or around 4 to about 9 or 10 per case at this point. So more contacts being associated with cases in the last couple of weeks, which is reflective of often large groups of people or multiple households, families living in single households, which increases the number of exposures in the home, and possibly people getting out and socializing as well. So we continue to see that, but the overall the hospitalization rate, or the increase in hospitalizations over time, is a slow, steady rise. It's not a fast increase, which would be concerning. Let's see, and that's it for cases and contacts. I would say in addition, we still see a disproportionate number of or rate of COVID-19 among our Latino population, and also among individuals. We believe among individuals that share that they work somewhere in the ag industry. And let's see. In addition to that, I'll just add that we did. The governor released the new guidance for expanded personal services. So body art, nail salons, estheticians, and others have guidance now from the state. And I can review the current indicators and determine that we're still at a place in Monterey County where the benefits of allowing those businesses to reopen with modifications can be balanced by the benefit of opening up those businesses can be offset with the slight increased risk of exposure, while still protecting our healthcare system from being overburdened. And also, in terms of our vulnerable population, those over the age of 65 and those with chronic medical conditions, still should stay at home whenever possible and only go out when they absolutely need to go out to receive or provide services. And we continue to work with skilled nursing facilities who have a large number of people who are vulnerable to COVID-19, and continue to work with them to make sure that they continue to implement CDC guidance on cleaning and disinfecting and use of PPE, personal protective equipment, to protect each other and to protect the residents. And working with them on strategies to implement state requirements that they conduct surveillance testing within their facilities. So still working to protect the vulnerable population. And that's it. I'll stop there.
All right, thanks very much, Dr. Moreno, for filling us in. And so then we'll start with some of the questions that we've gotten in on chat. The first one I think is for you, Dr. Moreno, and some of it we may need to forward it elsewhere, but as ag workers continue to be a large portion of the infected, is the county taking any steps to protect them or to inform their employers to practice safe protocols?
Yes. So I'll try not to speak for the Ag Commissioner, but the Ag Commissioner has issued updated guidance for employers of workers in the ag industry, which also provide for measures and strategies to promote physical distancing and use of face coverings. And so that work is ongoing. We in public health have and continue to work with people who have COVID-19 who admit that they're ag workers through our case investigators, to work with them to get them to a place where they can isolate and take care of themselves and not expose additional people. And if necessary, we have been referring to these individuals to the Emergency Operations Center between the hours of 7 a.m. to 7 p.m. to offer them alternative shelter and local hotels if we believe and they believe that they can't adequately isolate themselves during their infectious period. And the Emergency Operations Center also works with the Grower and Shipper Association to identify, recognize when one of the employees works for one of the ag businesses as partnered to provide for alternative shelter during their infectious period, and provide, the county and the Grower and Shipper provide support services as well when either one of us provides alternative shelter for the individuals who are infectious. We're also, through our contact tracing identifying family members to ag workers who are exposed and need to be in quarantine, and working with them as well to try to help them to quarantine appropriately. And on occasion, some people who need quarantine are also offered alternative sheltering. We're also working on messaging as well, expanding our messaging activities in Monterey County to reach the Latino population, which makes up a large proportion of those working in agriculture, and trying to do outreach and reminders of how we're still in a pandemic, and it's important that people keep their physical distance and cover their face and wash their hands frequently. I think, and then I'm not sure how recently we've done this, but we have worked with some of our local hospitals to specifically get testing more accessible to some of our farm worker community as well. And we continue to work with the Grower and Shipper Association and ag businesses to find ways to encourage and find ways for employees in the ag industry to submit specimens for testing to get those individuals, if they are positive, out of the workforce, so that they stop spreading it, at least in the workforce, in the work sites. So yeah, I'll stop there, but those are some examples of what we're doing to try to prevent further spread among our Latino population and ag workers, and doing the work that we're doing with that community and other partnering agencies to prevent further spread.
Thanks very much, Dr. Moreno. Dr. Gray, I've got two questions for you on the pop-up testing sites. And you might have alluded to this while you were speaking earlier. Where will the next site be located, or what are the sites under consideration at this time?
Sure, good question. I mean, we focused initially on Seaside, which was an area that had, a lower rate of testing for their population. Today we're in Marina, kind of splitting the difference between Seaside and a little further north in the Castroville area, which also had a slightly lower rate. When you look at the map, and unfortunately I do not have the map in front of me, there's certainly still some pockets in the Salinas Valley that based upon the report yesterday, that again had a lower rate of testing per the population in that area. So we're most likely to go to, the Salinas Valley next. We haven't picked an exact site for our next clinic. We probably will do so before the end of the week.
Thank you, Dr. Gray. And this next question it's referencing the pop-up sites, but I think Dr. Moreno may want to jump in on this one because it does refer to what areas have low testing frequency. And there was a map that you referred to that was presented yesterday. What areas of the county are showing a pattern for low testing frequency? And this is great because now we've got the map, right? Thank you, our PIO from the health department, for jumping in and throwing up the map so that we can see what we're talking about.
Okay, so I got the map up too. Let me make sure we're looking at the same. Yeah, good. All right. So as you can see on this map, I'm back up. So we are tracking where people reside, or where they say they reside, when they submit specimens for testing. And as far as we use rates by zip in each zip code, and the red areas on the chart show where there's a low rate of testing, meaning the number of tests per 100,000 per thousand population. So those would be far South County, and then also in North County, and then small area under Seaside as well. So those are low testing test rates in Monterey County. And the green is the includes the zip codes where there's the highest testing rate per thousand population. So there's sections in near in the peninsula area as well. So you can see the zip codes there, and those are, so that's what this graph map shows.
All right, thank you for that. And then I do have a question about the daily situation report, which I think I might be able to answer, but Dr. Moreno, you can confirm. The latest county daily situation report says 87 hospitalizations, and you reported 92. And the difference is that the health department is reporting in the morning new figures, and the daily situation report is coming out at the same time. And unfortunately, they have numbers from the previous day. Is that accurate?
That may be the reason. May I just the most reliable data will be the public health website.
Thank you very much. What can ag workers report their employer? Oh, I see. Sorry about that. What can ag workers report their employers for? For example, would forcing workers to remain in tight quarters with no PPE be something that they could report or complain about?
So well, workers have a variety of options. In a pandemic, the employees can certainly call our COVID telephone number and report with or without providing their name, the working conditions. The Ag Commissioner is primarily responsible for providing oversight of use of pesticides and some other responsibilities, but it's also another avenue that workers could access to complain about working conditions. And even outside of a pandemic, workers and anyone for that matter could also voice concerns about work conditions to Cal OSHA, who has the responsibility statewide for setting standards for employers for the purpose of protecting workers in California. The other thing, so that's where if people want to call anonymously or provide their name, those are always options. But I think it's really important that the anyone who's working in any business, if they have a concern about the work site, I think it's important that they hopefully if they're comfortable, that they work through their chain of command and meet with their supervisor and have discussions with their supervisors. There are probably some cases where the supervisors doing their best to try to create healthy work sites, and the employees who actually have to implement carry out the directives and the protective measures may have some ideas of how to make changes to improve the safety in the workplace. So employees should also, when all possible, work with their supervisors and their managers and the business owners.
Right, thank you, Dr. Moreno. Another question for you. Monterey County's test positivity rate and cases per 100,000 residents is exceeding the metrics set by the state for further reopening. So why is the county reopening more personal services on Friday? If the positivity rate continues to rise, what is the plan for rolling back reopenings?
Okay, so I haven't visited the state website to see if we've exceeded state thresholds, but I've been tracking our county indicators, and our county indicators continue to show what we expect: an increase in cases as businesses reopen with modifications. More people are leaving and assuming a greater risk of exposure to COVID-19. We'll continue to see higher numbers. The case positivity is on the decline. And so I think we're down to 9 or 8, I believe, at this point. It's around 8 or 9. And so that is dropping. And is, where is it? I'm sorry, 6.56. It's down to 6.56 now. So that's dropped. It's about half of what it was about a week or two ago. And so, as I mentioned, as the prevalence of COVID-19 increases in Monterey County, we anticipate that the test positivity rate will go up from time to time, as it did a couple weeks ago. And so it's down to 6.5, but that will probably go up again at some point, and then may come down again. So I will continue to watch that, but it's something that we would anticipate occurring in a pandemic. And there are no plans right now to increase restrictions here in Monterey County at this time.
Thank you, Dr. Moreno. This next question, I'm not sure if there's anyone on the call who can respond to this. I'll go ahead and ask it anyway, and then you guys can confirm, Dr. Gray or Dr. Moreno, whether that you can't answer this question. Is Community Hospital of the Monterey Peninsula receiving COVID cases requiring hospitalization from Salinas Valley? Are Salinas Valley hospitals at or near capacity? No, well, Dr. Gray, you might be able to answer it from the Natividad perspective.
Yeah, I can certainly only speak for Natividad. You know, our kind of rolling average of hospitalized patients has slowly increased over the past, weeks. We are certainly not approaching capacity levels at this time. So I think I would say it's very manageable at the present time. And while we have seen a gradual increase in the average number of hospitalized COVID patients, it's been very manageable.
All right, thank you, Dr. Gray. Hold on, I'm getting to our next question, which is about ag workers. How many ag workers are currently being isolated in hotels or other alternative sites? Gary Millay was on the call a little earlier, and I don't see him on the call now. I can forward that to him unless somebody else is able to answer that question.
So this is Charles. I'll chime in. A lot of the ag workers are being housed through a program with the Growers Shippers Association. They're managing those hotels because it's somewhat determinative on whether they can isolate themselves at home or in their living situation that they have. And so the actual numbers in those hotels, I don't know if that's something that's Gary has the numbers on or not.
And I can, I'll get back to the reporter who asked that question. I'll get back to you on that and see what kind of information I can provide. Going on to our next question, Monterey County Health recently tweeted, "Beware of companies trying to sell you tests, vaccines, or treatments." How serious is this problem here on the Central Coast, and what should people keep a lookout for to prevent being scammed? I'm not sure if Dr. Moreno could answer that, or if our health PIO is on the call, she might be able to add to that. So I'll look in, hearing nothing, I'll look into that and see if I can get you some more information after the call. Yes.
I just want to correct something. I was looking at the wrong test positivity rates. So I said that the test positivity rate was 6.5, but I believe that's our overall test positivity rate. What we look at for indicators is the test positivity rate for the past 7 days, and it's 8.6. So it's not half of what it was, but it is down from 12. So I just want to clarify the test positivity rate over the past 7 days is 8.6, and our threshold is 8.
Great, thanks very much for that clarification, Dr. Moreno.
And this is Karen. I can talk a little bit about fraudulent coronavirus tests, vaccines, and treatments. I tweeted that. I've been tweeting that for a bit because whenever you have a situation like this where there's an opportunity for the bad guys to reach out and get your money, they'll do that, and they'll claim that they will prevent or cure or treat, or that they've got a vaccine. Since we have no treatment, we have no vaccine, odds are it's not a good idea. It's fraudulent. So I would just ask people to check out the FDA and watch us, because as things come up, we'll share with you the new treatments when the vaccine's available, and just consumer aware, buyer beware.
Good advice. Thanks very much, Karen, for jumping in on that.
May
Yes, Dr. Moreno.
And run again. Sorry. I'm sorry. I'm jumping around here. Apologize to everyone, but one other thing I wanted to point out about our indicators is that we recently had, we were at 75% of hospitals with 14 days supply of PPE. And I think I mentioned last week that one of the hospitals received a shipment of personal protective equipment. And so we followed up with the hospital, and they looked at their, with how that last shipment last week impacted their supply, and they reported back that they have now, they also have at least 14 days supply of PPE. So that indicator was in the yellow as we gave them colors, and that's now, now we're back to 100% of hospitals having 14-day supply of PPE. Thanks.
Great, that's great news to share. Thanks very much, Dr. Moreno. Going on to questions, what do you attribute the daily increase in the number of cases so far in June? What role does reopening play?
So thank you. So as we continue to move through this pandemic, the virus, we can't stop the spread of the virus, but we can try do things to slow down the spread of the virus so that our hospitals don't get overburdened and we can protect the most vulnerable population. So as we, when we started, our initial response was shelter in place, and only essential services were to remain open. And that was the maximum restrictions that we had in place at any time. And that was effective in slowing down the spread of the virus. And as we reopen businesses with restrictions, more people are going to get out, most likely going to get out of their homes to seek those services, to get their haircut, or to dine at a restaurant, or just now we have and opening up retail stores and malls. So more people are going to be getting out of their homes for additional reasons, and that increases their risk of exposure and increases the public's risk of exposure from each other. So I suspect that's going to have a role in explaining why the number of cases are going up. In addition to the fact that we're in a pandemic due to a novel virus, and so we're still at a place where if more people are exposed, most of those people don't have immunity to the virus. So they're more likely, if they're a close contact, people are more likely to come down with COVID-19 now than much later on in the pandemic, when most people will have already been exposed to the virus. And we wouldn't expect the numbers to be as high later in the pandemic, but right now, a lot of people are still susceptible. So each of those close contact exposures has a higher likelihood of resulting in an infection and a new case.
Thank you, Dr. Moreno. And then I'm really grateful that our contacts over at Salinas Valley Memorial Hospital have sent in an answer to the earlier question about Salinas Valley hospitals being at or near capacity. They're telling us that they have seen rolling increases for COVID inpatients, and it is still manageable, similar to what Dr. Gray mentioned at Natividad. So that is great to have those other hospitals on the call with us during this time. Getting back to some of our questions, Dr. Moreno, can you start releasing the age range, race, ethnicity, and comorbidities of people who have died now that the number is more than 10?
Thank you for the question. Yeah, I have been working with our epidemiologists to determine at what point we might be able to release that information. It's information that we would like to release, but we'll continue to follow state and county protocols for when we can release that information. So when we get to a place where we can start breaking out by race, ethnicity, or age, for example, among those that have passed away. We would like to do so, but we're not quite at that place yet.
Thank you, Dr. Moreno. I do have a question in here that's referred really as an Ag Commissioner question, and I'm going to go ahead and forward that question, and then when I get a response, I'll send the response out to the rest of the group. So I'm going to continue on with questions for the staff people we have on the phone right now, or on the call right now. Dr. Moreno, you mentioned disproportionate rates for Latinos, farm workers earlier. I also noticed people 18 to 44 have had the most cases so far. Any ideas what's driving these trends?
Could you repeat the question again?
Sure. Earlier you were talking about disproportionate rates for Latinos and farm workers. The reporter is also saying that he noticed people age 18 to 44 have had the most cases so far. Any ideas what's driving that particular trend?
So I think I've already spoken about the ag workers and Latinos. So in terms of age, most likely it's has to do with the age of where most working adults fall into, and working adults working as essential workers or working in lower and lower risk jobs and work environments not only have a risk of exposure from at the work site, but they also have the risk of exposure between the employees, but also risk of exposure from customers. So I suspect that I can't tell for sure, but looking at the age range, I think it's that combination. And there's also there's some of the larger groups of individuals in Monterey County fall into those age ranges. So we also expect to see greater numbers in that age range as well.
Thank you. And then another question going back to the data. Are there any consequences for exceeding the 8% positivity threshold in terms of being allowed to reopen further?
I would share that we look at all the indicators together in the context of where we've been recently and where we believe we currently are and where we think we're going to be in the near or not so near future. And we also would have to look at the status of our hospitals and our healthcare system to continue to provide appropriate level of care and also protection for the workers in deciding, and also looking at the any trends, if we can identify any trends regionally or at the state level before deciding in consultation with California Department of Public Health whether or not we would have to slow down reopening business sectors or put additional restrictions back on certain business sectors.
Thank you. And then could you specify the state and any other guideline you are using to determine when you can release age, ethnicity, or other information on coronavirus cases?
Sure. So it hasn't changed. We have to have at least 5 events in any category before we can break that category out. At a minimum, at least 5. And if we break a group out of 5, we have to also take into consideration how we would categorize everyone else that's left in that group. So that's how we've been doing it, and we'll continue to do it that way.
All right, thank you, Dr. Moreno. That's all the questions I have sent in at this point. Is there any other questions for any of our presenters today? Giving a second for any quick typing and not seeing anything. So that will wrap up our media briefing. Just when wrapping it up, thank you very much. Here's a question. When, this is for Dr. Gray, I'm hoping you're still on the call. When would South County likely get a pop-up testing site?
Yeah, as I mentioned, we'll after today, we'll go and kind of look at the opportunities and where we should focus next. So likely our next testing site will be somewhere between, will be a spot south of Salinas.
All right, thanks very much, Dr. Gray.
And
Okay.
and it'll probably be next towards the middle to end of next week.
Great, thank you. Any other last minute questions for any of our presenters? If not, that'll wrap up our briefing. And I don't see any questions coming in now. So thanks for joining us, and we'll see you next time.
Thank you, Maya.
Thank you.